What we're going to work on is Noah's just over 2 months old.
Yep.
And he has some issues with turning his head over towards the left side. He's had that pretty much since birth.
Yep.
I think Mom and Grandma have both talked about that. Is there any other complaints? Is he colicky or anything like that? Is he
No,
pretty good?
he's been pretty good, yeah.
How's he doing as far as nursing?
Good.
Okay, can he nurse pretty well on both sides?
Yeah, I mean, he prefers, you know, the side he turns, but he does feed off both sides fine.
Awesome. So what I'm going to try to do is I'm going to gently take him through a range of motion. Babies are pretty agreeable to allowing me to do what I need to do. So
Yeah.
I'm just going to have Mom kind of rest a hand right here. Yeah. And then we're just going to take him toward the side that he really doesn't care for. There we go. And notice how his shoulder kind of pops up a little bit when I want to turn him to the left. I'm just going to kind of hold him over here until he gets a little angry with me because of the stretching I'm doing. But also too, over time he'll drop that shoulder and then he'll be a little bit more even with this range of motion. So we're just going to be patient with him. He'll kind of wiggle just a little bit. That's why I have Mom holding her hand right there. Just kind of gently, kind of stroking him. When you see him kind of twitching like that, that's normal. That's his muscles kind of releasing just like an adult would when you're stretching and you feel a little bit of a twitch.
Okay.
Yeah. Good. He's tolerating this very well. Good. Yeah. Okay, we're going to bring you back to center for a second. He also has just a little bit of skull misshapenness, and it was most likely from when he was inside Mom. So I'll also be teaching Mom how to do a little bit of skull shaping at home, so that way we can work on that some over time. All right, buddy. Yes. Good, good. There we go. A little better. Nice. Don't want to pop that shoulder up, so I'm going to bring him back to center.
Good job.
Good. Yeah. He'll lose patience. See, he wants to turn over that way, but I'm not letting him. There. Good. All right, good. There we go. Okay. Now we're going to go over this way again, buddy. I know. A little bit more. There. Good, good. Okay. Here we go. Good. All right. See, he's rubbing his eyes. He's getting a little bit tired of me. That's okay. Yeah. All right.
Good job, man.
There. Good. When I adjust him, I'll be adjusting his upper back, and also I'll be adjusting the right side of his neck. What I observe with babies is that their neck is typically stuck on the side they can turn the best.
Sure.
Yep. There we go. Yeah, I know. Good job, buddy.
Good job, Noah.
All right. Good. Okay. Good job, buddy. Okay, I'll have you kind of hold right here. Courtney, you can go ahead and kind of hold him right there. All right. There we go. We're just going to gently come over this way. There, just like that. Good job. Yeah, it was a little sore, buddy. Yeah. Good job. Good.
Good job. Hey.
And as you kind of saw, all it was is just a little bit of a finger.
Okay.
Just about that much is all it takes for me to kind of get him. One of the important things is the stretching, and he seems to be doing okay with it, that he's kind of arching his head back. And then I'll go over with you. I'll have you lay on the table and let you feel what I'm doing,
Okay.
especially when I'm doing the skull shaping, to try to get the left side of the skull to kind of go back and the right side of the skull to kind of come forward.
Okay.
Yes.
Good job, bud.
All right. Okay. Here we go. Okay, Mom, go ahead and just kind of rest your hand there. All right. So he adjusted very well. Now I'm going to go over with Mom how to do a little bit of skull shaping. Okay. So right now his skull is kind of shifted off towards his left.
Yeah.
And it's shifted kind of forwards, and the right part of his skull is shifted kind of backwards. Okay. So what we're going to do is we're going to gently, with our fingertips at the base of his skull. There we go. Okay. Just kind of do a little bit of a skin pull. Do you see his skin kind of coming up towards his middle part of his skull? There we go. And then you just kind of hold that position like that.
Okay.
His fontanelle at the top of his skull stays open until he's almost a year old.
Yep.
Okay, so he's got a lot of room that we can kind of work with his skull a little bit.
Okay.
This will hopefully make it so he doesn't have to wear a helmet.
Yeah.
Exactly. And his wiggling like this is totally normal. That's a lot of his skull muscles releasing.
Good job, buddy.
And just kind of like that.
Yeah.
Perfect. Yeah, he actually tolerated that very, very well. So now, Grandma, I'll have you come on over and I'll have you hold him. And then I'm going to show Courtney how it's going to feel for her to do some skull shaping with him at home.
Do you want me to pick him up? And
Yep. So, yep, go right ahead.
Good job, buddy.
All right. Okay, Courtney, why don't you go ahead and you can lay on your back.
Okay.
There we go. Okay. So, this is what I was doing with them. Okay. Just like this.
Okay.
All right. And then this is about all the harder you have to go.
Okay.
Once you see his skin kind of start to wrinkle a little bit,
Yeah.
then you know you've got it.
Okay.
Okay. You can also do this where you're kind of introducing this range of motion.
Okay.
Okay. This is all the harder that you have to pull. It's just very, very gentle. And you'll see him kind of do this. That's when you know you're getting a good stretch, is when he's starting to kind of wiggle and twitch like that. Because you're getting these muscles to loosen up. And then just bring him back to center.
Okay.
He'll want to go this way,
Sure.
but try not to let him go past center when you're doing his stretches.
Okay.
Just continue to kind of bring him right over this way.
Okay.
Perfect. Good. All right.
Good job, buddy.
Did he have any, were you induced or anything like that?
Nope. I think he was like a day early. Yeah.
But, yeah, okay,
But it was a natural. My water broke. Yeah. So
perfect, yeah.
it was a little stiff.
As far as, did you have back pain during your pregnancy?
Yeah.
Okay. It's real common for babies to kind of come out with a kink in their neck. If mom's having back pain during pregnancy, the baby a lot of times is sitting on the tailbone, and that's causing the mom to have symptoms. They can have symptoms go down the leg,
Yeah.
symptoms kind of go up the back, and just an overall discomfort in the hips as well.
Yeah.
And especially for first-time moms, because your body's never been there before. A lot of times with each successive pregnancy, I'll observe that moms aren't having as much back pain with their pregnancy. Also, too, if I see that a baby where the mom has had an induced labor, then I definitely want to have the baby checked, because the contractions are a lot stronger and the baby's head is kind of all
Sure.
torqued inside there.
Yeah.
And so some common things that I'll have moms report to me that a baby will have for symptoms include colic and reflux. I used to see a lot of ear infections. I don't see as many in kids anymore. I'm not sure why, but definitely now the two most common things are colic and reflux. A lot of times the moms will come in, the babies are already on a low dose of Prilosec to kind of help with some of the spitting up symptoms. And we're able to work with the baby, have the parents work on stretching and some skull shaping at home, that the baby can get off the medications and then just kind of function better. Everybody's happy when the baby's happy.
Yeah.